Hello student, welcome to the lecture on health economics, and after this lecture we will be able to learn the following objectives. Understand the significance of health economics, discuss about good health, a fundamental right, understand international covenants, acts and rules regarding public health, explain significance of good health, discuss about public health and economic growth, understand need for investment in public health, explain income elasticity and health insurance. Let's start with the introduction. Health economics is the study of how scarce resources are allocated among alternative uses for the treatment of sick people and the promotion, maintenance and improvement of health standards in the economy, including the study of how healthcare and health-related services, their costs and benefits, and health itself are distributed among the various segments of a society. It can broadly be defined as the application of the theories, concepts, and techniques of economics to the health sector. It is thus concerned with such matters as the allocation of resources between various health-promoting activities, the quantity of resources used in health services delivery, the organization and funding of health service institution, the efficiency with which resources are allocated and used for health purposes, and the effects of preventive, curative, and rehabilitative health services on individuals and society.
Hi, my name is Dr. Sanjay Sharma. I'm a professor of ophthalmology and epidemiology at Queen's University. As a researcher, I am very interested in a particular area of epidemiology called health economics. Part of the goal of health economics is to work out the cost-benefit numbers for new interventions in a way that can help doctors and policymakers make the often difficult decision on which interventions to pay for and which may be too expensive for the public healthcare system to fund. I want to give you a high-level overview on how we do this. The key thing is being able to put a value on a new drug or procedure. In healthcare, we measure value as a unit called QALYs, or quality adjusted life years. One QALY is equal to living for 1 year in perfect health. So how do we work this out? Well, what we do is we look at the average person with a specific disease, and then we look at all the outcomes of that disease both with and without the intervention that we are evaluating. For each possible outcome, we assign a probability and a utility score. The utility score is a measure of how much your quality of life would decrease with a certain outcome. For example, someone with wet macular degeneration might say that if they went blind, their quality of life would decrease by 55%. This would mean a utility score of 0.45. Using a mathematical model called a Markov model, we combine the utility scores and probabilities and other factors to determine the average benefit to someone with the disease who takes the drug which we are evaluating. We calculate that benefit over the course of the treatment and end up with the increase in QALYs caused by the drug. The next thing we do is look at the cost to society as a result of each outcome. Most obviously, we have to look at the cost of paying for the drug treatments, but then we also have to take into account the total cost of each possible outcome associated with both receiving the treatment and not receiving the treatment. For example, in eye care, we also have to consider the cost to the healthcare system if a patient went blind, including personal assistance, patient education, and continuing medical care. In this case, the blindness could have been caused by an adverse effect from the drug or through not taking the drug at all. Once we have determined the costs, we can then calculate the cost per QALY, or how much does it cost us to gain the equivalent of a year in perfect health for a patient. This cost per QALY becomes a standardized metric to evaluate new interventions. The typical scenario is that a new intervention provides an improvement in either the length or quality of life, but costs money. Then health economists and doctors argue it out as to whether the government should pay for the intervention. Most governments fund things that cost less than $50,000 per QALY and do not pay for others that are more costly. It is a complex analysis and we've only brushed on its surface, but I hope that we've been able to give you a small glimpse into how health economists work and how their analyses help us to run our healthcare system with a reasoned approach.
Let us now discuss significance of health economics. Health economics is a branch of economics which deals with the application of the principles and theories of economics to a healthcare sector. It addresses the issues such as the demand for healthcare services in the economy, allocation of resources for the development of healthcare facilities, the supply through public and private sector agencies, and the gaps that exist between the demand for and supply of healthcare services in the economy. Healthcare services are limited in supply and the demand for healthcare services is ever increasing and unlimited. Economic analysis, if applied properly, can often help to clarify what choices are for health policy, how to choose among different health services, how to decide what to buy and how to pay for it, and how to evaluate the end results of such consumption. Does the main function of a health economist include to identify the present and potential areas of health demand, to draw valuation in terms of market needs and for health services, to calculate the cost of delivering health services, to estimate the real cost of acquiring health services in terms of time, loss of working days and wages, traveling costs and cost of traveling the distance to seek health care in terms of money, as well as cost of not receiving timely treatment due to distance, to suggest right health policies in terms of cost-benefit analysis to the government. Conceptual background of health. Health is a multifaceted concept and thus it is very difficult to define it precisely. General notion about health is the absence of illness due to physiological and organic deficiencies. It is mainly concerned with an individual body's mechanical ability and functioning of basic parts and organs of human body. The broad definition of health, however, does not mean mere absence of disease, but it encompasses the whole range of personal, physiological, mental, social, and even moral well-being of a person. Holistic view of health. The holistic perspective not only takes into account existing technologies and their organization, it also underlines the importance of social determinants that contribute to people's well-being, such as food availability and nutritional status of population, drinking water supply, housing, transport, education, employment, and last but not least, the status of women. Meaning of public health. Public health is the science and art of preventing disease, prolonging life and promoting health through the organized efforts and informed choices of society, organization, public and private, communities and individuals. Let us now discuss good health, a fundamental right. The preamble to the Constitution of the World Health Organization (WHO) states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. Good health and human rights are inextricably linked. Violation of human rights can have serious health consequences. Let us now discuss another topic: international covenants, acts and rules regarding public health. Health is a state subject and in many areas the state government legislations are applicable. Given the enormity of the task of compiling all health-related laws, this compilation is restricted to laws applicable at the central level and those related to health and healthcare issues. The acts and rules in this compilation were collected over a period of time from different sources, too many to be mentioned. Act and rules are health facilities and services, disease control and medical care, human resource, ethics and patient rights, pharmaceuticals and medical devices, radiation, protection, hazardous substances, occupational health and accident prevention, elderly, disabled, rehabilitation and mental health, family, women and children, smoking, alcoholism and drug abuse, social security and health insurance, environmental protection, nutrition and food safety, health information and statistic, intellectual property rights, custody, civil and human rights. International covenants and treaties. Alma-Ata Declaration 1978, Basic Principle for the Treatment of Prisoners, Beijing Declaration, 4th World Conference 1995, CESCR General Comment 7, Right to Adequate Housing 1997, Convention Against Torture 1987, Convention on Political Rights of Women 1954, Convention on the Elimination of Racial Discrimination 1969, Convention on the Elimination of All Forms of Discrimination 1981, Convention of the Rights of the Child 1990, Declaration on Social Progress and Development 1969, Declaration on the Right to Development 1986, Declaration of the Rights of the Child 1959, Declaration on the Elimination of Violence Against Women 1993, Treatment or Punishment 1975, Declaration on the Right to Development 1986, Declaration on the Rights of Disabled Person 1975, Declaration on the Rights of Mentally Retarded Person 1971, General Comment 15, The Right to Water 2002, Right to Highest Attainable Standard of Health 2000, General Conference of ILO, Elimination of Child Labor 2000, International Covenant on Civil and Political Rights 1976, International Covenant on Economic, Social and Cultural Rights 1976, International Code of Medical Ethics 1994, International Criminal Code Elements of Crimes 2000, International Criminal Code Rules of Procedure and Evidence 2000, International Guidelines on HIV and Human Rights 1997, International Health Regulation 2005, Maastricht Guidelines on Violation of Economic 1997, Maastricht Guidelines on Violation of Economic 1997, Covenants and Treaties. Optional Protocol to Convention Against Torture 2003, Optional Protocol to International Covenant on Civil and Political Rights 1976, Principle for the Protection of Persons with Mental Illnesses 1991, Principle for Those in Research and Experimentation 1954, Principles of Medical Ethics, Role of Health Personnel 1982, Proclamation of Tehran Final Act 1968, Protection of Human Rights in Context of HIV and AIDS 1997, Right to Adequate Food 1999, Right to Highest Attainable Standard of Health 2000, Second Optional Protocol to International Covenant 1991, Standard Minimum Rules for Treatment of Prisoners 1977, Universal Declaration of Human Rights 1948, Universal Declaration on the Eradication of Hunger 1974, WHO Framework Convention on Tobacco Control 2005, WMA Declaration of Geneva 1948, WMA Declaration of Oslo 1970, WMA Declaration of Helsinki 1964, WMA Convening Torture and Other Cruel, etc. 1975, WMA International Code of Medical Ethics 1949, WMA Declaration of Death 1968, World Conference Against Racism 2001. Significance of good health. Health has a great significance from economic point of view. Healthy population is an asset for an economy, while ill and aged population is a burden. From the point of view of an individual, health performs dual function. On the one hand, good health represents a value of its own, a target that needs to be reached as closely as possible. On the other hand, there are other aims in life as well, such as good health gives good income in labor market. Therefore, the significance of health has been strongly emphasized by a number of international organizations. Economic implications of health. Good health contributes to the nation's economy in the following 4 ways. Enhance workers' productivity. The most obvious gains from healthier workforce are savings of workdays, enhanced workers' productivity, greater, better paying job opportunities, and longer working lives. In urban areas of Tamil Nadu concluded that if deformities with them are eliminated, then the expected annual earnings of those with job will enhance by more than 3 times. Improved utilization of natural resources. Health investment also contributes to better utilization of economic resources of a country. Many developing economies waste huge sum of money on treatment of various diseases rather than their prevention. This leads to wastage of resources. Multiplier effect of health expenditure. Extending to next generation. Poor health condition, inadequate sanitation and nutrition adversely affect the benefits of schooling primarily in 3 ways. Decreased enrollment resulting in increased illiteracy, poor ability to learn resulting in high dropout rates, limited participation by girls either due to poor health of self or others in family. Long-run reduction in cost of medical care. Health spending in short run prevents and reduces the incidences of diseases in long run and results in huge savings in treatment costs. For some diseases, the expenditure pays for itself, even when all the indirect benefits such as higher labor productivity and reduced pain and suffering are ignored. Polio is one such example. Significance of health expenditure. Health outcomes are a function of poverty, but more importantly, poverty levels are closely associated with public health investment, and hence, again, public financing of healthcare becomes critical even for poverty. There is a direct correlation between increase in health expenditure and economic development of a nation. Healthy and well-educated population is a driving force for the growth and development of nation. Public health and economic growth. As a convention, labor quality in the form of human capital contributes significantly to economic growth. Most cross-country empirical studies identify labor quality narrowly with education. The central argument is that this practice ignores strong reason for considering health to be a crucial aspect of human capital and therefore a critical ingredient of economic growth. Healthier workers are physically and mentally more energetic and robust. They are more productive and earn higher wages. They are also less likely to be absent from work because of illness or illness in their family. Illness and disability reduce hourly wages substantially, with the effect especially strong in developing countries where a higher proportion of the workforce is engaged in manual labor than in industrial countries. Health has a positive and statistically significant effect on economic growth. It suggests that a 1-year improvement in a population life expectancy contributes to a 4% increase in output. Need for investment in public health. Until the early 1990s, health was relatively neglected as a factor that influences national economic performance. Much of the focus was only on the education, an important component of human capital. Today, improvement in health constitutes an important element of what has come to be known as pro-poor economic growth strategies that have the potential of enhancing economic growth, while simultaneously reducing economic inequality. There is now a considerable body of international evidence that suggests that while improvements in national economic performance may positively influence health, there also appears to be a strong link running from improved health to improved economic performance. In fact, evidence shows that about 1/3 of the increase in income in Britain during the 19th and 20th century could be attributed to health and nutrition. Demographic factors: increase in population, shift in demographies, rise in disposable income, increase in lifestyle-related diseases, rising literacy. Economic factors: tax benefits, medical tourism, insurance coverage. Income elasticity of demand for healthcare. The concept of elasticity has an important role in economics. The understanding of elasticity of healthcare demand and expenditure is important to understand the health economics of the country and to guide policy making. Income elasticity. Definition. Elasticity in economics refers to a change in demand or supply of a commodity or a service in response to the change in its price or consumer income. Demand for healthcare. Healthcare is not a single commodity or service, but it consists of a basket of services which are consumed simultaneously. Is healthcare a luxury? The Economist magazine stated this a conventional wisdom in 1993, writing, "As with luxury goods, health spending tends to rise disproportionately as countries become richer." Income elasticity and health insurance. When consumers have the benefit of free access to healthcare, changes in their income does not have an effect on their ability to obtain such care. The demand for health insurance does not significantly change with personal or family income. The estimated income elasticity in the two studies were in the range of 0.01 minus 0.15 and 0.03 minus 0.04 respectively with health insurance.
Today's topic: how does health insurance work? The simple answer is, it's about economy of scale. Since time began, mankind has found safety in numbers. Health coverage is no different. When you sign up for coverage, you join a group of other people to combine your healthcare purchasing power. Your insurer covers the whole group rather than individuals, so everyone shares the cost of staying healthy. It's a lot like an auto insurance company that collects premiums from its customers, then uses that pool of money to pay accident claims when a customer has a wreck. Here's an example. Gary's a healthy guy, but it's his first time skiing. Moments after stepping off the lift, he plummets down the wrong slope and hits a tree. Then 5 more trees. Then he slides over the edge of a small cliff and is promptly hit by a falling safe. Just then, his wife calls to inform him she's about to deliver twins. Gary's about to be buried under a lot more than snow, because costly medical events like these can be devastating without health insurance. His broken leg and concussion can cost thousands to treat, and depending on the circumstances, the birth of his twins could cost anywhere from a few thousand to 100,000 or more. Fortunately, Gary has health insurance. Remember that group we spoke of? Since the costs are spread out over everyone, the people in Gary's group are actually helping to offset his costs. Gary's going to pay a lot less to treat his injuries and deliver his kids because his insurer is betting that the money the group pays in will offset the total costs of their health expenditures for the year. In a sense, the healthy people in the group help pay the costs when someone is sick or injured, knowing that the same help will be there when they need it. So instead of paying thousands of dollars, Gary's out-of-pocket costs are minimal. He's only responsible for his copay and his deductible, which vary by insurer. So to sum it up, health coverage reduces your risk of financial disaster because your health costs are spread across a large group of people, and the healthy people help pay for the sick. So now you know. Until next time, stay smart and stay healthy.
Income elasticity and user fee. The utilization of healthcare services by the poorer parts is affected by the introduction of user fees, possibly due to its regressive nature. This argument presupposes that the poor are more price sensitive for health services than the rich are, and regarding the elasticity, the demand of these poorer part lies on the elastic segment of the demand curve of the community. Disease burden in India. Knowledge and understanding of the epidemiological profile is an essential prerequisite to access and address public health needs in the country. It also enables efficient planning and management of communicable and non-communicable diseases in the country. India's epidemiologic transition. All countries during the course of their development pass through what is known as an epidemiologic transition. Epidemiological transition means the change in disease profile of the nation, where the initial high burden of disease and mortality due to infectious disease and maternal and child mortality declines and gives way to non-communicable diseases, injuries and geriatric problems as the main burden of disease. India's epidemiologic transition, however, is marked by 3 challenges in disease control, all of which need to be managed concurrently. First, India has to complete its unfinished agenda of reducing maternal and infant mortality as well as communicable diseases such as tuberculosis, vector-borne diseases of malaria, Kala Azar and filaria, and waterborne diseases such as cholera, diarrhea diseases, leptospirosis, and the vaccine-preventable measles and tetanus. Second, India has to contend with the rising epidemic of non-communicable diseases including cancer, diabetics, cardiovascular diseases, chronic obstructive pulmonary diseases, and injuries. Finally, India has to develop a system to cope with the new and re-emerging infectious diseases like HIV, avian influenza, SARS, and novel H1N1 influenza. Now, in the end, let us summarize what we have learned in this lecture. The scope of health economics includes relationship between health status and productivity, financial aspect of healthcare services, economic decisions making in health and medical care institution, planning of health development, and such other related aspects. Healthcare services are demanded by people as a means by which people achieve good health that builds the standard of human capital of a nation. Health programs have come to be seen as part of a comprehensive strategy aimed at improving the social and economic welfare of population. There is a need to design programs which improve health services and the provision of other infrastructure such as water and sanitation, and also the action aimed at improving nutritional health most efficiently. Health Assembly adopted a resolution which said that the main social target in the coming decade should be the attainment by every citizen of the world of a level of health that will permit to lead a socially and economically productive life.